Hey guys, welcome to Medifaction. So today we're going to learn about the anatomy of elbow joint. We may know that the elbow joint is a synovial joint found in the upper limb between the arm and the forearm. So in order to learn more, let's go deeper and let's begin. So in this video, I'm going to enumerate about the elbow joint, starting with an introduction, and we will discuss about the articular joints of the elbow joint and the ligaments present on the elbow joint, the relations, the blood supply and nerve supply, and also we are going to discuss about some of the movements, and finally we are going to end this session with the clinical anatomy of elbow joint. Introduction. The elbow joint is a hinged variety of synovial joint between the lower end of the humerus, this is the lower end of the humerus, and the upper ends of radius, which is on the lateral side, and the ulna present on the medial side. Elbow joint is the term used for humeroradial and humeroulnar joints. The term elbow complex also includes the superior radio-ulnar joint also, that is the joint between the radius and ulna. Articular joints. On the upper, the capitulum and trochlea of the humerus. So this right here is the capitulum and this right here is the trochlea of the humerus. The coronoid fossa lies just above the trochlea. Here you can appreciate the coronoid fossa which lies above the trochlea and is designed in a manner that the coronoid process of ulna fits into the extreme flexion. So here will be the ulnar bone and the coronoid process of ulna fits into it in the extreme flexion. Similarly, the radial fossa just above the capitulum. This right here is the radial fossa. This is the capitulum. This allows for the radial head fitting in the radial fossa in extreme flexion. Going to the lower, upper surface of the head of the radius articulates with the capitulum. This is the capitulum and the upper surface of the radius articulates here. Trochlea notch of the ulna articulates with the trochlea of the humerus. The elbow joint is continuous with the superior radio-ulnar joint. The humeroradial, the humero-ulnar, and the superior radio-ulnar joints are together known as cubital articulations. So, to recall what we just learned once more, this is the capitulum of the humerus. This entire is the humerus and this is the capitulum which articulates with the upper surface of the radius. This is the radius bone and here is the articulation taking place. And this right here is the trochlea of the humerus which is articulating with the trochlear notch of ulna. This right here is the ulna. And the circumference of the head of the radius articulates with the radial notch of ulna, forming superior radio-ulnar joint. Now the ligaments. Number one is the capsular ligament. Superiorly, it is attached to the lower end of humerus in such a way that the capitulum, the trochlea, the radial fossa, the coronoid fossa, and the olecranon fossa are intracapsular. Inferiormedially, it is attached to the margin of trochlear notch of the ulna, except laterally. Inferiorlaterally, it is attached to the annular ligament of superior radio-ulnar joint. The synovial membrane lines the capsule and the fossae named above. The anterior ligament and the posterior ligament are thickening of the capsule. Number 2 is the radial collateral or lateral ligament. This is what I was talking about. So it is a fan-shaped band extending from the lateral epicondyle. This right here is the lateral epicondyle. So it extends from here to the annular ligament right here. It gives origin to the supinator muscle and to the extensor carpi radialis brevis. Third one is the ulnar collateral ligament, which is triangular in shape, as you can see. Its apex is attached to the medial epicondyle of the humerus right here, and its base to the ulna right here. The ligament has thick anterior and posterior bands. These are attached below to the coronoid process and the olecranon process respectively. Their lower ends are joined to each other by an oblique band which gives attachment to the thinner intermediate fibers of the ligament. The ligament is crossed by ulnar nerve and it gives origin to the flexor digitorum superficialis. It is closely related to the flexor carpi ulnaris and the triceps brachii muscle. Relations. So anteriorly, the elbow joint is related with brachialis muscle, median nerve, brachial artery, and tendon of biceps brachii. Posteriorly, it is related with triceps brachii and anconeus muscle. Medially, it is related by ulnar nerve, flexor carpi ulnaris, and common flexors. On the lateral aspect, it is related with supinator muscle, extensor carpi radialis brevis, and other common extensors. Blood supply. The blood is supplied from the anastomosis around the elbow joint. So, here you can appreciate the brachial artery, which divides into radial and ulnar artery, forming lots of anastomosis. I hope I could make another video for the anastomosis around the elbow joint itself. Nerve supply. The joint receives branches from the following nerves. Number 1 is the ulnar nerve. Number 2 is the median nerve. Number 3 is radial nerve. And number 4 is musculocutaneous nerve through its branch to the brachialis muscle. Movements. Flexion is brought out by the brachialis muscle right here, the biceps brachii with two heads, and the brachioradialis muscle. The extension right here is produced by the triceps brachii. This here is the humerus and this is the triceps brachii and also the anconeus muscle. Now let's move on to some important clinical anatomy. Number 1 is subluxation of the head of the radius, which occurs in children when the forearm is pulled in pronation suddenly. It is otherwise called pulled elbow. The head of the radius slips out from the annular ligament. Number 2 is tennis elbow. This usually occurs in tennis players. Abrupt pronation with fully extended elbow may lead to pain and tenderness over the lateral epicondyle. This right here is the lateral epicondyle, which gives attachment to common extensor origin. This is the common extensor origin because it's on the lateral side. This is possibly due to sprain of radial collateral ligament, tearing of fibers of the extensor carpi radialis brevis. Recent researchers have pointed out that it is more of a degenerative condition rather than inflammatory condition. Number 3 is student's elbow, which is characterized by effusion into the bursa over the subcutaneous posterior surface of olecranon process. Here you can observe the bursitis. Students during lecture support their head with their hands with flexed elbow, usually for sleeping purposes. The bursa on the olecranon process gets inflamed like this. Fourth condition is dislocation of the elbow is usually posterior and is often associated with fracture of the coronoid process. the triangular relationship between the olecranon and the two humeral epicondyles is lost. Number 5 is the golfer's elbow, which is a microtrauma of medial epicondyle of humerus, occurs commonly in golf players. The common flexor origin undergoes repetitive strain and results in painful condition on the medial side of the elbow. Hope you have understood the video. Like, subscribe and press the bell button for more videos. Thank you. Thanks for watching.